So today we're going to talk about hydrocortisone, or more specifically intravenous hydrocortisone. So this is based on Mims Asia. So one of the famous brands is Solu-Cortef. Okay, it contains hydrocortisone sodium succinate. So the initial dose for adults is usually 100 to 500 milligrams intravenously over a duration of 30 seconds to 10 minutes. And this dose may be repeated at intervals of 2, 4, or 6 hours. And for children, the initial dose is 0.5 to 8 milligrams per kilogram daily in 3 or 4 divided doses. So for example, if a child is 10 kilograms, so you could give potentially 0.5 times 10, which is 2 kilograms. So, and 2 kilograms, if you divided it by 4, then you get 0.5 milligrams for 4 times a day. Okay. So the administration of IV hydrocortisone is preferably after food, and the presentation is for injection is 100 milligrams per 2 milliliters, which is 50 milligram per meal. Okay, so it's 50 milligram per meal. So for example, in the example that we've given previously, if you're giving, for example, 100 milligrams IV over 30 seconds, so how many mils of hydrocortisone is that? So going back to the next slide, so it's 100 milligrams, so it's 2 milliliters. Okay, if you want to give 100 milligrams of hydrocortisone, then it's going to take 2 milliliters. And if you're going to give 300 milligrams, then that's going to be 6 milliliters of hydrocortisone. So depending on the dose that you will require, then you will decide how many milliliters of hydrocortisone IV will you withdraw before giving to the patient. So what are the indications for giving hydrocortisone? So the indications include severe shock. Okay. Secondly, acute hypersensitivity reactions. Okay. Acute allergies, reactions to allergies. Okay. Thirdly, overwhelming infections with severe toxicity. Okay, that warrants. This is one of the things that warrants giving an IV hydrocortisone. Fourthly, SLE in relapse. So relapse of SLE, you may give hydrocortisone IV. And then aspiration pneumonitis. Okay. So pneumonitis that develops due to aspiration, that's an indication for giving IV hydrocortisone, or we call it IV hydrocort. And then acute adrenocortical insufficiency. Okay. And then bilateral adrenalectomy. So we know that the adrenals is the source for our cortisol in the body. So when you undergo bilateral adrenalectomy, so you are deprived of your source of cortisol in the body. So you lack your endogenous cortisol. So you will need cortisol that is given from outside. So you can give IV hydrocortisone, okay, for in patients with bilateral adrenalectomy if indicated. So notable contraindications include systemic fungal infections, okay, fungal infections that are widespread, or patients who have been given live attenuated vaccine, such as smallpox, muscle mumps, rubella, varicella, influenza, rotavirus, herpes zoster virus, and yellow fever vaccine, okay, and also ITP. Okay, so these are the notable contraindications to giving IV hydrocortisone. So special precautions when giving IV hydrocortisone include avoid injecting the deltoid muscle, okay, and not to be used intrabursally or for intratendinous, so not to be given in the bursa or for inside the tendinous and not inside the tendon. So you can't give it intrabursally or intratendinously in order to get the local effect. You can't do that. Okay, or I mean, not you can't do that, but you have to be careful when giving that in that way. So, and also you have to be aware of the fact that giving IV hydrocort may worsen or exacerbate or make it worse, make worse systemic fungal infections and intercurrent infections. And you have to use it cautiously in patients with known or suspected infestation by strongyloides, and also in active or latent tuberculosis, glaucoma, and also ocular herpes simplex. And IV hydrocortisone may also aggravate existing emotional instability or psychotic tendencies. Okay, so it may worsen patients who have psychotic tendencies. Okay, patients who have tendencies to get delusions and also hallucinations. Okay, and then you have to do intraocular pressure monitoring. Okay, to avoid getting glaucoma, and this is needed if therapy is above more than 6 weeks. Okay, so if we are treating the patients for more than 6 weeks, then we have to monitor the intraocular pressure. Okay, we need help from the optometrist or ophthalmologist to monitor the intraocular pressure, and we have to avoid abrupt withdrawal, okay, of the hydrocort injection, and also that you have to be aware that it may affect the ability to drive and use machines. With regards to pregnancy category, it is C or D, okay, in the first trimester. So corticosteroids have been shown to be teratogenic in many species when given in doses equivalent to the human dose. So it's been shown in animals, okay, in a few species that when you give the doses that are equivalent to the doses given to humans, so it has been shown to you are able to see teratogenic effects. Okay, so to be more precise, there was increased incidence of cleft palate in the offsprings in studies involving pregnant mice, rats, and rabbits. Okay, and as there are no adequate, well-controlled studies in pregnant women, it should only be used in pregnancy if the potential benefit justifies the potential risk to the fetus. And infants, okay, babies born to mothers given corticosteroids during pregnancy should be observed for signs of hypoadrenalism. And for lactating mothers, breastfeeding mothers, it should not be taken. Okay, if the mothers are breastfeeding their children, their child, so they shouldn't be taking IV hydrocortisone. And corticosteroids given systemically appear in human milk, so there is expression in the human milk. It will be expressed in the milk, and this could suppress the growth of the child and also can interfere with the corticosteroid production endogenously, okay, and also can cause other unwanted effects in the child. So that is all for now. Okay, see you in the next video. Thank you.